What is the best treatment for my under eye? My under eye circles and hollowness came on within the last 6 months. What direction should I go that will give me the best results?
Thank you for your question. You've submitted a single photo showing both eyes, and your concern is about hollowness and dark circles that have appeared over the course of the last 6 months. Well, looking at this photo, certainly I can appreciate what you're describing. I think the majority of your concern is in the area that we refer to called the tear trough. In addition, there's also an area adjacent or towards the center of the eye, of each eye, which is called the V-deformity, or the junction between the eyelid and the cheek, where as we get older we lose some volume. In your right eye, you appear to have a little bit of puffiness in the outer aspect, but this might just be an artifact of the photo. But in terms of addressing relative hollowness under the eyes, we can certainly share with you our approach in our practice. I'm a cosmetic oculofacial plastic surgeon. I specialize in eyelid surgery and eyelid rejuvenation, and in practice in Manhattan and Long Island for over 20 years. This time in the medical field is an exciting time because we now have more options than we used to for dealing with this volume loss. So in our practice, our approach is to address volume with a filler such as hyaluronic acid. Hyaluronic acid comes in several different brand names, including Restylane, Juvederm, and can really be very effective in restoring contour in this very delicate area. The trick is to be able to place the material into the areas that need to be placed and avoid lumpiness, irregularity, and swelling. A lot of times people get a little overambitious and they fill more and they make the eyes look more puffy. So there's an art to that. And with that placement, you can really get significant improvement. The way the skin of the eyelid, which is the thinnest skin in the body, just rests against the bone when there's less tissue in between, it just makes the area look very, very dark. So a filler is a great solution and is worth exploring. Downside of fillers is there is maintenance involved. And a lot of times people want to try to go for something more permanent, such as something like fat transfer. From my perspective, I have not seen very good results from fat transfer. Fat grafting, unfortunately, does not really apply uniform filling, and a lot of times people get irregularities and lumps. People come to us from all over the world who have had fat grafting, and we actually remove the fat because it creates these irregularities and problems. So I tend not to use it. I like to do things that are more predictable and are able to really minimize the patient's downtime. In a world where everyone's busy, prolonged swelling is not acceptable for any reason. So the other thing that we also do that is also unique actually is something you call platelet-rich plasma treatment. Platelet-rich plasma, or PRP, is derived from your own blood, and what we're essentially doing is we're concentrating the platelets and the growth factors necessary for wound healing and applying them under the skin. And what we've seen is improvement in color and quality and just overall health of the skin. In fact, when we use PRP on the rest of the face, whether it's for acne scars or for just complexion improvement, we get the patients always come back with this nice glow because it stimulates this blood supply, and this is something that makes it really different from fillers. So our approach is to apply a synergy to this area. We do the filler for the volume and PRP to improve the skin quality. and we have had a very high level of satisfaction from our patients. We follow our patients closely to make sure that the contour and the shape is really nice, and we'll tweak if necessary. Again, this is an art, and it has to be done artfully. A lot of people try to differentiate themselves by saying they use different tools such as blunt cannulas and other things to minimize bruising, and certainly that's respectable, and of course it depends on the hands that use the instrument, but it is an art, and getting the material in the right place, in the right volume, and getting the right shape is artistic. So I can't drive that point home enough. But the synergy with platelet-rich plasma has been very, very effective. Now, these fillers can last anywhere from 3 months, 6 months, and even up to a year, and sometimes even beyond. But it is individual, so you have to kind of see what works for you. It is very common for patients to ask, give me the longest lasting filler. But very often the longest lasting filler may be too thick to use in this area. So there's always some type of customization that has to be part of this, and an acceptance that you'll need to do this on some kind of regular basis. Facial aging is volumetric loss. It's loss of bone, muscle, and fat. So restoring volume strategically and keeping a natural look is important, and it is a commitment. So with that being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.